This is my health and survival plan for you. This is up close and personal. Recently, I took care of Mr. Thompson in my emergency department. Mr. Thompson, 65 years old, very frail, showed up with sore throat for 1 week. This was his second visit. He was today accompanied by his daughter Brenda, and Brenda right away let me know that she was not taking no for an answer, and she was in a rush, and I was going to take care of her dad. Now, Brenda stood about 5'8", she was 200 pounds, very intimidating, almost had the physique of a middle linebacker. She let me know that her dad was not improving on the penicillin that he was sent home with. Now, as I took further history, Mr. Thompson, sore throat had been for well over a year. He had lost about 40 pounds. He was a heavy smoker and a heavy drinker. So as I examined Mr. Thompson, asked him to open his mouth, and I looked at the back of his throat, you could see where little bite marks, little kind of nibbles of his tongue was missing in the back on the right side of his mouth. His teeth was rotten, and you could tell he hadn't seen a doctor in a very, very long time. And so I asked him, I said, this has been longer than a week. He said, yeah, doc, it's been a long time. It just got to the point where I couldn't eat anymore because it was too painful. So I'm here now. So I said, well, Mr. Thompson, why didn't you come sooner? He said, well, doc, I don't trust you doctors. You always talk over my head. I don't have health insurance, and I just don't have time to sit here and be bothered with you guys. And I get it. You're busy. Mr. Thompson's a proud man. He didn't have insurance, so he felt like he didn't want to be a burden to his family and to the system. And most importantly, he did not trust doctors, and I get that. There's been many studies in the past which medicine cannot apologize for that was done against patient's will. But those days are no more. I am here to take care of you. And so are my healthcare colleagues and the healthcare profession. We're here to take care of you. So use us. Don't sit around and wait till it's too late. So right away, I ordered a CAT scan with IV contrast to get a full high definition image of Mr. Thompson's neck, his vessels, the muscles, the bone, and what was happening in his throat. So he rushed off the CAT scan, and the CAT scan came back, and it unfortunately confirmed my suspicion. I grabbed the sheet of paper as it came through the fax and read. It said that Mr. Thompson had necrotic lymph nodes, which is dead tissue, and a 2 by 3 centimeter mass, which was highly suspicious for cancer. And now I had to go tell Mr. Thompson and Brenda. So I made my way back into the room. I grabbed my green stool. I pulled myself closer to Mr. Thompson. I looked both him and Brenda in the face, in the eyes, and said, your CAT scan revealed that you have cancer, and we have to admit you to the hospital. Right away, the tough girl, Brenda, his rock, his demanding, his voice, his daughter, the toughness just folded into his baby girl. She immediately fell into her daddy's arm. Mr. Thompson, thin arms, wrapped Brenda physique into his arm, and he embraced her, and she began to cry. And I could not help but think about my own father in this situation, who was diagnosed with prostate cancer, and how resistant he was at first to go to the doctor, but realizing that I was his bridge, his conduit to the medical profession. He trusted doctors a lot more because of me. Mr. Thompson didn't have that. And so we admitted him to the hospital, and ultimately his prognosis was 3 to 6 months he was given, maybe a little longer with palliative care, maybe a little longer with chemo, radiation, some palliative care. Don't let that be you. Mr. Thompson showed up in my emergency department well into his second year with these symptoms. And the point is, whether you come year 2 or you come day 1, you still show up. He still showed up in my emergency department. So why not come day 1 when your choices are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10? When you have many choices. He had no choice in this situation because he waited too late. So make sure you do the right thing. Show up early, go see your doctor, make sure you get your examinations at certain ages, year 50 of age, golden age. You got to go get your colonoscopy, your mammogram, your prostate exam. Do the right thing so that you are here for your loved ones. Mr. Thompson had grandbabies who he's not going to see grow up, who they have to now go eventually to their pop funeral. Can you imagine? This all could have been for naught. It was my job to tell Mr. Thompson to stop drinking, to stop smoking, to get these examinations done. And this all could have been addressed a lot sooner. Do the right thing. Don't be tough. Don't go out there thinking, I can doctor it myself. Go see a doctor and go early so then you can have a bucket list of things to choose from to treat your situations. Don't be like Mr. Thompson. Let's stay around for a very long time here.